here are the age-related the etiologies. For example, in the birth age, estrogen withdrawal, and in the early age before puberty, the most common cause is the foreign body. Okay, so these are other causes, but most common is the foreign body. And in the puberty, after puberty, you mostly see the complication of pregnancy. For example, the ectopic pregnancy, the mole or antepartum hemorrhage, postpartum hemorrhage, which is due to the atonia or anything which can complicate the pregnancy. Okay, after the 40, first you should think for the malignant until proved otherwise. Although malignancy is not most common, but it's a most serious condition. Okay, so endometrial hyperplasia or the endometrial carcinoma. So these are most serious condition. But the most common is what? It's a vaginal and endometrial atrophy, due to which the different infective agent grow. So that can cause the infection, and that lead to the abnormal uterine bleeding. Okay, so you can see here is the leiomyoma. Female with the leiomyoma, the fibroid, or you can say. So these are different clinical picture of the fibroid. Okay, and in this side you can see the small polyps here, and here you can see also the endometrial polyp. Okay, and in this picture, adenomyosis, and adenomyosis is what? When the endometrial the gland, they enter into the myometrium. Okay, so you can see this is the adenomyosis, and here is the ovarian tumor, cystadenoma. In dysfunctional uterine bleeding, so the common history is the irregular and unpredictable bleeding. Irregular and unpredictable bleeding, and this is without cramps. Okay, and there is no cramps. And if you look at the causes, as I mentioned, by the age, adolescence, the reproductive age, and the perimenopausal. So the major cause is anovulation. So this is, as I mentioned, anovulation cause the endometrial hyperplasia, which increase the risk of malignancy. So we have explained already. So one other condition I want to discuss is the metropathia hemorrhagica. So this is breakthrough bleeding, which is due to temporary decrease in the estrogen. So there are two types of the bleeding. One is breakthrough bleeding, other is the withdrawal. So if you look at here, so breakthrough bleeding where the hormone is present, which causes endometrial thickness. So if there is a temporary decrease in the hormone like estrogen, so this lead to the heavy menses, which are unpredictable and irregular. Okay, so this is the breakthrough. While in the withdrawal, you will see there is a pattern of bleeding. Okay, so this is usually predictable, but the breakthrough is the unpredictable and it's irregular and heavy menses. While in the withdrawal, this is not a heavy menses, so this is usually a pattern of the bleeding. Okay, so breakthrough bleeding and the withdrawal. So the condition is the metropathia hemorrhagica. What is happening in the metropathia hemorrhagica? So there is the continuous presence of the proliferative phase of the menstrual cycle, which present with the abnormal excessive bleeding. So due to persistence of the proliferative phase of menstrual cycle, what happened to endometrium? So it gives the Swiss cheese appearance, where you see the back-to-back arrangement of the gland. So this is the Swiss cheese appearance. Okay, so where you see the back-to-back gland. Okay, so this is one of the condition of the endometrium. Okay, so here you can see the palm, and on this side coin. So these are the structural abnormalities, and these are the non-structural or dysfunctional abnormalities. Here is the some review of the pathogenesis and the clinical finding why they are caused the bleeding. So you can, most of the time you see the high level of estrogen or the anovulation in the dysfunctional, or there is underlying abnormality, so they can cause the bleeding. Okay, how we approach the abnormal uterine bleeding? By looking at the age. After menopause or more than 40 years, if before puberty or in the reproductive age. Okay, if after menopause, you know better, most common cause is the atrophy, and most serious condition is the endometrial hyperplasia and endometrial carcinoma. Okay, and before puberty, most common cause is the foreign body's introduction, and maybe due to precocious puberty, early puberty, or the infection, sexual abuse, trauma, or tumor. So they can cause the the abnormal uterine bleeding. But in the reproductive age, so first of all, you should think of the pregnancy complication. In the early, the abortion, ectopic pregnancy, vesicular mole, and in the antepartum hemorrhage, placental and extra placental causes, and the postpartum hemorrhage due to atony, trauma, retained placenta, and other cause is the drug complication. Most common cause is the contraceptive, irregular, and the combined oral contraceptive or intrauterine devices, and antiplatelet, anticoagulant, so they can cause the bleeding. So first of all, you should rule out these causes. Then you go for the ultrasound and go for check the palm can. Okay, if she gives the history of the regular period and but the unpredictable and without cramp or predictable with cramps, then you should think of structural abnormalities, mean the palm, the polypedenomyosis, leiomyoma, or malignancy. So, and if she give the history of irregular period and unpredictable, no cramp, then you should think the dysfunctional uterine bleeding. Okay, where you think the coin. Okay, and in the polyps you usually see the intermenses bleed, and the adenomyosis you see the heavy bleeding, and in the leiomyoma there you will see finding of the submucosal and intramural spaces. Okay, and there is malignancy finding which you can see by the pelvic examination or by the ultrasound. Okay. What is the treatment? Of course, treat all these conditions. Whatever the condition, you should go for their treatment, which we discuss in their own lecture. Okay, and if in the dysfunctional, if ovarian disorder and ovulation, so usually you see the thick endometrium, and aspirin, which is anticoagulant, it can cause the dysfunctional uterine bleeding. So, what is treatment for the dysfunctional case? So, first of all, you should treat the cause. So, for example, a coagulation disorder or any the hypertension, liver disease, thyroid, whatever. So, try to treat the cause if present. If the condition is ovarian disease, then you should think it's a menorrhagia or the metorrhagia. If it's a menorrhagia, then you give the NSAID and the antifibrinolytic, so and the venotonic. So these are the initial steps to the stop bleeding. So if it's a metorrhagia, I mean irregular bleeding, so then you give the combined oral contraceptive progestin, because they stabilize the endometrium which is undergone the hyperplasia due to the unopposed estrogen. Okay, and then you can also give the long-term contraceptive like intrauterine devices or Mirena if the patient is old or the multipara. Okay, and if the bleeding is heavy, it's too heavy, so you can initially you want to control it, give IV conjugated estrogen, first 25 mg, then 2.5 for next 25 days, and add the medroxyprogesterone acetate 10 mg for last 10 days of the 25 days drug. Okay, so if the condition heavy bleed, you can give GnRH analogs in the heavy bleeding, but you cannot give for long term because it can cause the osteoporosis or the menopause symptoms. If the patient is not improving, you go for the surgical process like the DNC, mean dilatation and curettage in the severe bleeding, and endometrium ablation if the uterus is normal and you do not find anything. So of course then you go for the endometrium ablation. Okay. And the uterine artery embolism if the fertility is needed. So you embolize the uterine artery. Last option is total abdominal hysterectomy with bilateral salpingo-oophorectomy. Here you can see the uterine artery. We are embolizing them, giving the embolized material through the femoral artery, which reaches here, and it embolizes the uterine artery. Okay, especially you can see in the fibroid condition we are giving them, and here is the uterine artery which is supplying this area. Okay, and this is the ablation where you give a balloon which is a heart balloon, so it destroys the endometrium. So this is endometrial the ablation. Okay, so this is also same picture which show we give the balloon which is heart balloon, so it ablate the endometrium. Okay, here is a bilateral salpingo-oophorectomy, and here is the total the total mean the uterus is removed, fallopian tube is removed, as well as the ovary is removed. Okay, so this is all about the abnormal uterine bleeding. Thank you very much. Allah Hafiz.